Over the last number of years, Saskatchewan's chief medical health officer was someone we talk to once in a while, but the pandemic has made Dr. Saqib Shahab a household name in our province, and it's been quite the year for him. He joins me now. Thanks so much for your time, Dr. Shahab.
Yes, hello. Nice to connect with you again.
I know that you are in the thick of daily numbers and analysis and information, but when you think about this year as a whole, what stands out to you?
Well, I think obviously we all prepare for pandemics and worst case scenarios, and we don't really expect to see something this significant in our own careers. And the fact that it happened is significant for all of us, not just work in public health and healthcare, but I think all of us who live and work in Saskatchewan. Having said that, I did hear a story today about a person who was in a long-term care facility. For her, this has been her second pandemic, major pandemic after 1918. So, obviously, the world has seen major pandemics in the past. Um, the other thing, of course, is the way we've all pulled together. I think, we prepare for the worst in society and the worst case scenarios and the worst outcomes. But I'm always surprised when there's a crisis in Saskatchewan, how people, for the most part, pull together, and the impact is much less than it could have been if we were not pulling together and we were chaotic, not just in healthcare, in our day-to-day work, in how essential workers kept going. I think that always, humbles me to see how people really pull together.
How difficult is it to maintain your personal, professional, medical opinion with the politicians making the decisions that run our province?
So I think for me, I've always throughout my career looked at the evidence and then presented that in as clear a way to the public and to whether it's a government or any other group who wants to understand what's happening, and then ultimately, the stakeholders, which includes the public, governments, the health system, they all have to see what is feasible in terms of the response. So, in a pandemic, the response is not just a health response or a public health response, it's a whole of government and societal response. And there, of course, the responses can be slightly different, and we've seen that across jurisdictions. And even in Saskatchewan, the response have to be modulated, they have to be proportionate to the issue. You can't go all out at once. You have to apply as much of a restriction or a measure as you need to at a particular time.
Have you ever recommended something that the Premier or the Health Minister has not agreed to implement?
I don't recall any major recommendations that were not agreed upon, but like I said, and it's not just a matter of the Minister of Health and the Premier. We watch closely what case numbers are in other provinces and other parts of the world, what response measures have been put in place, are they working well or not, what are our interventions, how do we need to tweak them. For example, our reopen Saskatchewan guidelines served us well over the spring, summer, fall, but now we've had to change them because with the high case numbers, we've had to tighten many of our guidelines. And so that's, I think, something that we need to adjust consistently.
Contact tracing has been a pretty significant issue. How do you factor that into your decisions when we aren't able to really determine where people are getting infected, like, say, a curling rink or a hockey game?
Yeah. So there's two parts. One is contact tracing, the other is exposure assessment. Contact tracing, initially it was very easy. You've come back from overseas and you have two or three contacts, mostly household contacts, easy, everything was in lockdown. As things opened up, it became more challenging. People are out and about. So, and I've always said that, you wear a mask all the time now. You should keep your physical distance. So even if you turn COVID positive, 2 days before you onset of symptoms, you should be able to say, for the most part, I was not closer than 2 meters without a mask to anyone who's not in my household. I think that is what the standard should be now. And if you were, obviously, you need to let those people know. And that's the other piece, of course, that in my own circle, I've got calls from people who said, I've got a fever before, in the summer, in the fall, when we could get together in limited amounts, they would say, I don't think I was closer to you than 2 meters. and we were wearing a mask. But this is just to let you know, so I can self-monitor, and then when someone goes for testing, they're positive, people have let their close friends and family or colleagues and co-workers know, and I think that is really the standard. We all know the drill. COVID is no one's fault. It's a respiratory illness. Even if we take the best precautions, we can get it, and then we need to quickly let people who are close contacts know ourselves. And of course, public health does contact tracing. And it assists those complex investigations in schools and workplaces. Obviously, we have people who have other challenges. They may not have stable housing. So that those are those complex investigations where public health puts in a lot of effort. But for the most part, we now know the drill. We shouldn't be closer than 2 meters without a mask for anyone for more than 15 minutes. And if we were, we should let them know if we test positive.
When it comes to a vaccine, a two-part question. Will you get it? And where do you put yourself in the queue if you are going to get it?
Yeah, so I was asked that question when we were sequencing vaccines for H1N1. I just started working. And at that time, of course, the vaccine sequencing was pregnant women, children under 15, because H1N1 impacted younger populations more. COVID is different. It's the other extreme. It's people over the age of 40, 80, residents of long-term care. They are first in line, along with selected healthcare workers who provide care for them, like in long-term care or in ER, ICU. So they are front in line. I don't provide frontline healthcare worker in an ICU, so I will likely be eligible when my age cohort becomes eligible.
But you do plan to get the vaccine?
Of course, definitely. I mean, we will not come out of it successfully unless all of us are vaccinated. And by all, I mean there may be less than 1% who may have a true contraindication. But, we will not get out of it till we all get vaccinated over this year, over 2021.
Well, let's look to 2021. We will hit the 1-year COVID anniversary in March. What is your information telling you about the outlook for next year?
Yeah, so I think, our first wave, which for many jurisdictions was the second wave. This is our true first wave. This was we knew that it would likely happen in Saskatchewan. This is our true test, and this really we have all these restrictions in place, but the test is we have to stick to our households over December, holidays, Christmas, and then into January, February, March. I think that is essential. By March, the most vulnerable will be protected by the vaccine, long-term care, 80 plus, and then 75 and older, 70 and older, and then April, May, 5-year decrements. So by the time spring comes and summer rolls in, our proportion of population being clinically protected will increase. So hopefully we can enjoy summer as much as or even more than we did this year, with lesser restrictions, but some precautions will have to be in place. And then, of course, over the summer, younger adults, school-age children, we all need to get vaccinated, because that's the only way we can drive transmission down to a level that in the fall we can see a more normal return to life after a successful vaccination program and a high uptake.
Thanks so much for your time, Dr. Shahab.
Okay, thank you very much.
Dr. Saqib Shahab is Saskatchewan's Chief Medical Health Officer.